The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Chemthorne Motors, and of course our technical producer this morning, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and joining us by phone from Columbus is our very special guest, Antonio Ciaccia, Director of Government and Public Affairs for the Ohio Pharmacists Association. Thanks for joining us, and good morning, Antonio.
Good morning. How are you all today?
We're doing fine. How about you?
Hey, we're doing great. We're having fun, and we are working towards positive reform on drug pricing. So we're excited.
Marvelous.
All right. Well, if you may have seen in the news lately, there's a lot changing with insurance and pharmacy billing practices. We've all heard the terms gag orders, clawbacks, and maybe not such common terms in PBMs, but they're common terms in our pharmacy world. PBMs are pharmacy benefit managers, and we're all going to talk about in more detail with Antonio about what it all means. There's some legal changes happening in Columbus, and they're being spearheaded by a local Canton politician. More importantly, what does it mean for the consumer is the big question today, and we're going to find out this morning. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile smartphone. You can look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, anywhere you go, and this will be one that you will want to share with your friends. If you have questions during today's program, you can post them up on our live Facebook feed, or you can give us a call here at the station at 330-450-1480.
So, Antonio, you've been on the show before, but can you tell our listeners a little bit about yourself and what you do with and for the Ohio Pharmacists Association?
Yeah, absolutely, Paul. I was born and raised in pharmacy. My dad is a hospital pharmacist up in the Cleveland area, and he also worked at an independent pharmacy as I was growing up. When I was a kid, I always looked up to what he did. Not what he actually did behind the counter. I was attracted to pharmacy because of what I saw when he came home after he was at work. There would be friends, family members that would call him and say, Tony, my son or myself or my mom or dad are having a medical issue, and the doctor is really concerned. And they prescribe me this medication. I don't know what it is. I don't know how it's going to make me feel. I don't know when I'm supposed to take it, or what other things I should or should not be taking with it. And that type of hand-holding that he would do over the phone was ultimately what drew me to pharmacy. It's helping a patient ultimately through a disease state. In the context of pharmacy, it's via drug therapy. And I always was enamored with the idea of the pharmacist as the medication expert, and the person who ultimately is going to walk you through your disease state after you leave the hospital or the doctor's office, which tends to be the most important part of managing a chronic illness. So that's what drew me to pharmacy. I originally was a pharmacy technician at Mark's Pharmacy in the Cleveland area. I think Mark's is down in the Akron-Canton area as well. It's like a deep discount store. And I did that for 3 years and went to Ohio State to actually become a pharmacist. Within 2 years, I said, pharmacy is really boring. I don't want to do this anymore. And I became very... Yeah. You all might have wished you had the same impulse. And after about 2 years in the program, I got much more interested in public policy. So I switched my career track over to public policy, and look where it took me. It brought me right back to pharmacy. So I have lived and breathed pharmacy. As I said, my dad's a pharmacist. My sister is a Walmart pharmacist in the Canton area as well. So if pharmacy is my entire life, I think I end up muttering it in my sleep sometimes.
Okay, interesting. Okay, so you're in Columbus, and you must have the latest happening on pharmacy costs and legislation. There's been a lot of media focus here, Columbus Dispatch and all that sort of thing in the last few weeks. So what's happening?
So let's use issue 2 as the starting point. If you all recall, I know listeners recall all the ads that we heard back in October, September, November about issue 2, the Drug Price Relief Act, which was very incorrectly named. Issue 2 was a dumpster fire, but issue 2 was the right diagnosis. It was the wrong prescription for the diagnosis. Everybody knows drug pricing is a big deal. Drug prices are out of control. They are unsustainable. They are busting the budgets of employers, local governments, state governments, federal governments, and they're also busting the wallets of consumers at the point of sale on their copays. The costs to all of us are going up, but in reality, there's a lot going on that goes far beyond the pharmaceutical companies, which certainly deserve to be beaten with a wet noodle in many regards. But if you're only telling the story of the pharmaceutical company, you're missing the entire story. And issue 2 did a really good job of highlighting the dysfunctions in what happens between the production of a drug and when it actually ends up in your hands at the pharmacy counter. And since then, the legislature and the Columbus Dispatch, and actually the Canton Repository has done a really good job on a couple articles over the last couple months in highlighting what I would consider to be the most dysfunctional marketplace, not only in healthcare, but I would say in the entire economy. Everybody is complaining about drug prices, but nobody actually knows what prices are because there's a complete lack of transparency. And the good news is that Representative Scott Lips, Representative Kyle Kaler, and local to you all, Representative Thomas West, have been absolute lions trying to figure out and address what is a totally broken system.
Okay. I've been a pharmacist for 52 years. People have been complaining about the price of prescriptions all the time that I've been in this profession. Why now?
I think if you rewind the tape, maybe not 50 years, but even 40 or 30 years, insurance was less of a component of the transaction at the pharmacy. You had what could be considered much more of a traditional marketplace. And when I talk about a traditional marketplace, I mean when you go to the grocery store and you're picking out all the items that you want to purchase for food consumption, you're making pricing decisions based upon your own individual value proposition. You are making the conscious decision, how much money do I have and how much am I willing to pay on this product? And for better or worse, pharmaceuticals worked like that years and years ago. Now, there's a double-edged sword to that. In the old days, if the medication was too expensive, the patient didn't get it. And the advent of insurance ultimately created a bridge to obtaining products that maybe you otherwise would choose not to or you couldn't afford. And so insurance kind of filled in the gaps. And the old style of insurance was if something catastrophic happens, insurance will pick up the bill. But we as consumers really changed how we want our insurance to work. And our expectation as consumers with the pharmacy counter was, well, we don't want to pay anything. And so as the reliance on insurance and thus the middlemen pharmacy benefit managers increased over time, your power as a consumer ultimately was forfeited. And so now we don't have a functional marketplace. We don't have one where a consumer says, I don't want this product. Because the second a consumer says that I'm not going to buy something, that ultimately has an impact on the price because the supplier of that product will bring down the price to make it enticing to enough consumers. We just don't have that anymore in pharmaceuticals. And so now that we essentially have somebody else paying the bill for us, we have really become disengaged from holding this system accountable. And because of that, I believe that is why drug prices have just gone absolutely through the roof.
Okay, I'm going to tell you what. I'd love to keep on going here, but we've got to take a break. Okay, so hang in there. First break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center Pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on medshoprx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with Antonio Ciaccia, Director of Government and Public Affairs for the Ohio Pharmacists Association. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. So, Antonio, we're really rolling here. And what does this mean for the average consumer customer?
So ultimately, if you're a patient and you're on one medication, 10 medications, 15 medications, ultimately you have a very complex system at its core. And it is one that, like any complex system, without a significant level of understanding or transparency, it can be taken advantage of. And there are many instances that we've seen where we do think that the consumer is being harmed, meaning that they're paying a lot more than they should. And if it doesn't impact your wallet at the point of sale, let's say you're a consumer and your copay for all your medications is relatively inexpensive, $10, $0, somebody's paying the bill. And that's either your employer or it's your state or federal or local government. The government is paying a significant amount of the transactions at the pharmacy at this point. And so just because you might see a small bill, and many patients do not, be clear, but if you don't see it at the point of sale at the pharmacy counter, just know that it's happening behind the scenes. It may not be pulling money out of your wallet right there at the pharmacy. It's just happening on your tax bill. And ultimately, what the Ohio legislature is doing is trying to make sure that ultimately this system is more accountable for you, the taxpayer, and you, the patient. This lack of transparency can be exploited, and ultimately consumers and taxpayers need to be protected in some way.
So, it sounds like what's happening is good news when you say, but how much more, how deeper can we get into this, and what are our solutions here?
So let's highlight two specific issues, and I'll start with one that's local with you all. Representative Thomas West, who is Canton area, and Representative Scott Lips are specifically working on legislation that just passed out of committee about a week ago that will prohibit what's called clawbacks and gag orders. What is happening at the pharmacy, and you all might be able to attest to some of this, is sometimes it's cheaper to not use your insurance or your PBM. And
what you're saying is an actual cash payment as opposed to a copay type payment, where the copay is more money than the actual cash price of the prescription.
Exactly. Let's say I were to walk into your pharmacy and I didn't have insurance and I needed an allergy medication. Your cash price, let's say, if I don't have insurance, might be $20, $25. The second that I give you my insurance card, all of a sudden you run the claim, and all of a sudden it tells you, the pharmacist, to charge me $30 on that drug that was otherwise $20. Pharmacists have to have contracts with your insurance company and their PBM in order to have access to you as the patient. So ultimately, the pharmacy really is beholden to whatever terms the PBM or pharmacy benefit manager require of them. And in some PBM contracts, they specifically direct a pharmacy to overcharge a patient beyond what the cash price would be. And then rather than actually allowing the pharmacist to walk through what might be a cheaper option, which would be to pay without insurance, they specifically put language in some of these contracts that prohibit pharmacists from telling the patient that it would be cheaper if they didn't pay with insurance. At the Ohio Pharmacists Association, and me personally, I find that reprehensible. Yeah. The pharmacist-patient relationship is one that's predicated on trust, and those types of gag orders are totally counter to that philosophical construct between provider and patient. And so the good news is the Ohio House of Representatives is taking this on in a bipartisan manner. They're going to prohibit those overcharges, and they're going to eliminate the gag orders. And this issue has really picked up steam. Right when the Ohio House was taking this on, it was creating such a media firestorm that, whether coincidentally or not, at the same time, the President of the United States, Donald Trump, along with his Health and Human Services Secretary, Alex Azar, did a big press conference where they said they are going to get rid of these gag orders. And that's a huge win for patients.
Very good. That's really interesting.
You know, Antonio, I feel like we almost are handcuffed by some of these contracts that you speak of, because I feel like it betrays our integrity. So if you walk into the pharmacy and I run your card and it comes back at $50, but you happen to go down the street and just ask for a price and they come back and say it's $25, it makes me look like a bandit. And that really is something that really I have a problem with. So I'm really glad that there's been so much publicity to help the patients and the consumers educate themselves. I think it's fair that everyone listening today, when you go into the pharmacy and you get your prescription filled, don't be afraid to ask the pharmacist directly, what would the cash price be? Because if we're directly asked what the cash price is, we can give you a cash price without being beholden to what your insurance company is. So it's like two separate conversations. So the consumer has a right to know. It's just these gag orders right now keep us from informing the patient what they want to know, and it's kind of a tough rock between a hard place. So,
and the good news is, as I said, Representative Thomas West and Representative Scott Lips, they're carrying House Bill 479, and it is going to address all of this. And without getting into the details, if you're a consumer, what it means is at the pharmacy you will pay the lowest price possible. And that's what every pharmacist wants to do. Regardless of all the gimmicks and all the games, you should be paying the lowest price possible.
We're going to come up against our news break here in about 2.5 minutes, but maybe we could start to kind of talk about, too, some of the other things that have been going on, that especially the Columbus Dispatch and even the Canton Repository have reported with respect to the alleged overcharging of PBMs to state-funded Medicaid programs. Can you give us a little bit of explanation of what's going on there?
Yes, this is the biggest story in the industry right now. And 4 months ago, I had a sit-down meeting with the Columbus Dispatch. I met with Marty Schladen and Kathy Kandinsky to talk a little bit about what we found to be two things that don't make sense. And those two things are pharmacy reimbursements through the Ohio Medicaid program have arguably never been lower. Pharmacists have reported to me a drop of about 60 to 80% in gross margins through the Ohio Medicaid Managed Care Program over a 2-year stretch. Meanwhile, despite everything you hear in the news, for the most part, many drug prices are going down, and we can discuss what that looks like a little bit later. But when drug prices are declining and pharmacy margins are declining, both within the state Medicaid program, theoretically, that means that the state of Ohio should be spending less on prescription drugs. What we ended up finding out is that the amount that the state is paying has gone up 20% over the last 2 years. You might as well be telling me it is snowing in July. It makes absolutely no sense. And so the Columbus Dispatch started to dig, and what they found did not sit well with them. And what they originally thought would be about 2 or 3 big stories on the PBM industry has now turned into over 30 stories in the last 3 months. And they are now catching on like wildfire nationally. Just this week, the Wall Street Journal editorial board just skewered what is happening in Ohio, and it is indicative of what might be happening across the country.
Wow. Okay, bottom of the hour is here. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Spring is in the air, and it's the perfect time to shop Northeast Ohio's largest auto mall with one click at KimThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz. Something for everyone's price range. And KimThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? It's never a problem. We have a huge selection of pre-owned vehicles to choose from. The Kim Thorne family name's one you know and trust that's been committed to our community for over 80 years. Shop KimThorne.com.
Spring has sprung at Studio Arts and Glass with our annual Garden Art Show, June 8th and 9th. Local artists fill studio with pottery, jewelry, blown glass. Watch our craftsmen create beautiful stained glass windows or make a succulent live wreath. Call to reserve your space today or just come in for the Killer La Pizzeria Brownies. That's Friday, June 8th and 9th from 9 to 8 p.m. Studio Arts and Glass in North Canton on 77 and Apple Grove.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about pharmacy benefit managers and clawbacks and gag orders with Antonio Ciaccia, Director of Government and Public Affairs for the Ohio Pharmacists Association. There's a lot more to cover, so let's get back to the show.
All right, Antonio, this morning we've been talking about all kinds of crazy stuff that basically affects every person in the country and the state that takes a medication of any type. Before our commercial break, you were talking to us about basically some shenanigans that have been discovered going on between Ohio Medicaid services for consumers and the cost differential between what the state is being charged and probably what pharmacies are being paid. Any other information that you'd like to share with our listeners that would help them be a little more aware of what's going on and, maybe give them some impetus to contact their elected officials to help them express their displeasure and being taken advantage of? Because I'm thinking about patients, especially Medicare Part D patients, that rely on that program to help them buy their medications. And I'm thinking if drugs are being artificially inflated and being billed that way, it's probably going to get them to their donut hole a lot faster, which is going to be a health concern for them down the road.
Absolutely. This goes back to the patient first and foremost. And we all know drug prices are out of control. But are there things that are artificially inflating them beyond what they actually are? And if you're a patient and you have struggled with how much you're spending on your prescription drugs, there is an entire system of people in the middle that are making money off of them. And the question to you, the patient, is: are those people providing value? Is the amount of money that they're pulling out of the price of your prescription, is it even close to the value that they're providing you as a patient? And I think that the reason you're seeing such a big firestorm right now is the PBM is a claims processor. They're not really doing much more beyond that other than determining what your copay will be and essentially siphoning the data from your prescription records over to the insurance company.
I like to compare that to basically, it's like when you run your Visa or MasterCard. I mean, that's all it is. They do the electronic paperwork. Would you agree?
That is correct. I mean, they do have some things where they're actually creating formularies where they're determining, hey, maybe this drug is not appropriate for you. But that is a very, very minimal function. At its core, they are Visa, MasterCard. You are correct. So why is it that these companies that are essentially just processing claims, Why is it that the three largest ones are all in the top 25 largest companies in the United States? Most people, when you think about prescription drugs, they will tar and feather the pharmaceutical companies for gouging the marketplace. But most people don't know that the top three PBMs, they make more money on an individual basis than Johnson & Johnson, Pfizer. The biggest pharmaceutical companies in the world aren't as profitable as the PBM industry.
Interesting. Wow. Okay. What about clawbacks? Have we spoken about that yet?
Yeah, so a clawback is essentially it's in conjunction with what is occurring with gag orders. You're a patient, you walk into the pharmacy, it's that $20 prescription if you're paying cash, and then all of a sudden the PBM, if you insert the insurance card, all of a sudden that $20 prescription turns into a $30 prescription. Your pharmacy doesn't keep that overcharge. What ends up happening is on a remittance later on, whether it's a month or two later, the PBM comes back and claws back that overcharged amount. Sometimes they claw back even more than the $10 overcharge. And so what the legislature is trying to do, Representative Thomas West and Representative Scott Lips are trying to do, is to make sure that, look, if the PBM is going to take back money from the pharmacy, then the patient should be the beneficiary of that. Ultimately, whatever the price is being negotiated between the PBM and the pharmacy, you guys might laugh at using the term negotiated because these terms are largely dictated.
Yeah.
But if the PBM is getting a discounted rate at the pharmacy counter, ultimately the only reason the PBM is getting it is because they're representing the patient. So what they're trying to do is make sure that whatever the discount that the PBM is getting, that the patient also gets it at the point of sale at the pharmacy counter. That's good policy.
Wow. Okay. A term benefit manager doesn't sound interesting by itself, but can we dig into what a PBM really, really does? I mean, you mentioned a couple things they don't do, but is that it? How have they gotten such a hold on the industry?
It's a great question, Paul. I think a lot of it has to do with a fundamental lack of understanding of how drug pricing works and how prescriptions are bought and sold. You have employers, you have local governments that are sitting there paying for prescriptions for their employees or the people that are ultimately their beneficiaries, and it's a very complex world that we operate in. And so what they try to do is outsource the expertise necessary to manage the costs to these PBM vendors who are ultimately just middlemen. And the problem is that the PBM is not a fiduciary, meaning that they have no obligations to actually deliver savings to the people that are contracting with them. All of this is starting to unwind a little bit because now all of a sudden the employers, the government, everyone is sitting there looking and saying, have we basically given PBMs a blank check? And I don't know if PBMs are necessarily engaged in fraudulent behavior. I don't know necessarily how much they make because none of it's transparent. But what we do know is every time we turn over a rock to see what's going on and actually get to see what's going on, we don't like what we see. And the people that are paying the bill don't like what they see. And that's why you're seeing this major firestorm, not just, in the state Medicaid program, but employers are looking at this. The Medicare program, there's currently $1 billion lawsuit, whistleblower lawsuit, between Aetna and one of their chief internal actuaries with allegations that they have been overcharged and taxpayers have been overcharged to the tune of about $1 billion just on what they call spread pricing, which is PBM profits off of the difference between what they're paying pharmacies and then turn around and bill back on the other side of the transaction. $1 billion just within one Medicare Part D program. That's just the tip of the iceberg.
Amazing. Don't we have a state insurance agency, something that sort of monitors these things? Or?
There is the Ohio Department of Insurance is more of a consumer-oriented agency. And what they basically do is if you're a patient and you feel that there is a benefit that you were supposed to receive and your insurance company isn't delivering on it, that's kind of where the Department of Insurance steps in. And they also exist to make sure that insurance companies are maintaining some level of solvency, so that just in case something does go wrong and insurance companies are on the hook to pay the bill, they need to make sure that they're ultimately solvent enough to pay the bill. And so that's really the role of the Department of Insurance. They have not really gone beyond that role in many regards, and I don't know what the appropriate role is for them or not. But I do know that PBMs are ultimately licensed and regulated by the Department of Insurance. And look, for better or worse, healthcare is one of the most highly regulated industries in the world. There is one sector, though, that is highly underregulated, and that is the PBM industry. I think the fact that they have become so profitable, I don't think that's a coincidence that in a highly regulated industry, the one entity that is underregulated has somehow managed to really be able to profit off of that system. I'm not necessarily a fan of regulation, but at this point, that ship has kind of sailed on healthcare. And so you're either going to have transparency and accountability or you're not. And if you don't be surprised when you get taken for a ride.
Yeah, for sure. Well, sadly, it's our third break, and we're probably going to run out of time. I'm looking for maybe another hour from JD today. So thanks for joining us today, and be back in a couple minutes. Okay.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
You won't want to miss this upcoming Kiko Absolute Auction June 7th with auctioneer Bill Gill Jr. You'll find a huge Lionel train collection including U.S. Army, Union Pacific, and Amtrak cars, a caboose, oil tankers, tracks, signal flashers, and more. Other items available include Star Wars toys and action figures, Barbies, Legos, trading cards, Spider-Man, Hulk figures, Batmobile, collectibles, Hummel figurines, and more. Mark your calendar for Thursday, June 7th at 3 p.m., 3201 Parkway Street Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for pictures, directions, and more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're talking this morning with with Antonio Ciaccia, Director of Government and Public Affairs with the Ohio Pharmacists Association. So, I'm not sure if we covered this, but what about people who pay cash versus bill through insurance? It seems pretty simple, but this new legislation plays a big role in conversations people can have with their pharmacists. Are we ever going to be able to... I never really thought about being closed mouth, if you will, as a healthcare professional. How did this happen?
Well, here's the issue, Paul. Not every pharmacist is like you and Brad. I know you all well enough that if you see something wrong, you're going to say something. But not every pharmacist gets to operate in an independent pharmacy where they can act on their own volition. You have a lot of employee pharmacists that do a good job, but they also ultimately, have to refer back to the employee manual. And so not every pharmacist plays along with these gimmicks. This legislation that's currently being proposed in Ohio will make sure that those kind of ethical dilemmas don't occur. The truth is, your pharmacist should never be put in that position in the first place. And that's why the legislation that Representative West and Lips are carrying is so important.
It makes me think, too, Antonio, about... so let's say a patient comes in the pharmacy and they are well-informed enough to know to ask the pharmacist what the cash price is before they provide their insurance card. The interesting thing about that is let's say they find out that their prescription cash copay or out-of-pocket price might be $5 or $10 or even $15 less than what the insurance price is. The real bummer to that is if they're trying to meet a deductible, it's not going to apply toward their insurance deductible. So they're already paying for insurance benefits, whether it's coming out of their paycheck or their employer's helping them pay for it, and they still don't get to take advantage of the insurance benefits they're paying for because the insurance company's kind of gouging them on the other end.
Yeah, it's a ripoff, plain and simple. And the folks at the federal level and CMS, they've been talking about getting rid of this because honestly, it not only impacts the patient, but it also rushes that patient into catastrophic coverage quicker if the amount that the patient is paying is overinflated. So there are multiple angles to this where the patient is either getting hosed at the pharmacy counter or they're getting hosed on their tax bill. The federal government has never been one that's known for speed, but I would love to think that something like this should be kind of a no-brainer.
So where's House Bill 479 go next? So it's in the House now for discussion and then a vote, correct?
Yes, so it was just reported successfully and unanimously out of the House Government Accountability and Oversight Committee, and it is awaiting a vote on the House floor. The Ohio House of Representatives is currently in the process of trying to elect a new Speaker of the House, and so once they do that, I would anticipate that this will jump on their agenda. And then hopefully it gets through the House, it will then need to go through the Senate. So if you're a patient, and this is something that matters to you, and you want to ultimately impact the price that you pay at the pharmacy counter, this would be something you want to talk with your elected officials about. The good news for some of your folks in your geographic area over there is one of the legislators that is most central to you, Representative Thomas West, well, he's not only on board, but he's actually leading the charge. So it's everyone else you have to worry about.
Okay. So what about, let's jump a little bit differently. As an independent pharmacy owner, this process seems to be huge for us, but what about, let's talk about the big box pharmacies and the role they've played with this PBM thing.
So yeah, it's a complicated industry. I think a lot of your big box pharmacies have traditionally operated with pharmacy being somewhat of a loss leader for them. If you think about Walmart, I don't know the ins and outs of the Walmart business model, but I do know that a lot of it is predicated upon some of the items that they are selling on the front end of their store. An independent pharmacy is going to be more reliant upon pure pharmacy and a Walmart or a Target will be a little bit more skewed towards the front end of their business. So they might be willing to sign up for a lot of this stuff, whereas an independent pharmacy might look at some of these things that are going on and say, boy, I really don't like this industry, or I don't like this contract. The problem is that the independent pharmacy does not have all the leverage of those big box suppliers. But those big box suppliers end up essentially setting the norms for the industry. So what you have is your independent pharmacists are kind of along for this ride. The good news is that the independents, by virtue of definition, they're independent. The people that are working to reform this industry are independent pharmacies. They are the whistleblowers of the pharmaceutical industry. And the good news for Ohioans is there's still about 520 independents left, and they don't take any crap.
And that number is dramatically down from, 2,000? I can't remember.
There used to be about 1,200 independent pharmacies in Ohio if you rewound the tape about 15, 20 years ago. There's been a massive amount of attrition. There's been a loss of 164 community pharmacies that's independent and chained together. So 164 pharmacies have been deleted off the map in the state of Ohio, gone, not replaced, in just a 2-year stretch. Over that same time period, even big pharmacies like Walgreens and Walmart, they only saw very, very little gain. Walgreens has an extra 2 locations net in Ohio over a 2-year stretch. That puts them in third place in terms of growth. Richmond's Pharmacy, which is local to you all, they had an increase of 3 pharmacies over a 2-year stretch. The only pharmacy that is experiencing a massive amount of growth is CVS Pharmacy. They have an increase of 68 locations over that same time period. And it just so happens that they set the reimbursements for everybody else.
It's interesting, isn't it? Okay. All right, we're close on time, Antonio, and it's really wonderful talking to you and helping clear the air, if you will, a little bit on some of this stuff. So we know this is a really complex scenario. What are your final comments on this?
I would say as a consumer, just know that you think, and we all agree, that drug prices are going up. But in reality, do you actually know what the price of drugs should be? If you walked into a grocery store and saw that the gallon of milk was $9, you would say, this is a ripoff, there's a problem here. But the truth is, nobody knows what the price of lisinopril or aripiprazole should be. And ultimately, we've put a lot of trust in PBMs to ultimately deliver and give us savings. But the problem is that every time we look, or almost every time we look, many of these PBMs aren't holding up their end of the bargain. And so the Ohio Medicaid program, and I applaud the governor's office on this, and the auditor of the state, Dave Yost, they're all looking into this because they're not going to take this for granted anymore. And you as a consumer need to make sure that your elected officials are ultimately making sure that this system is held accountable. If it's not going to, if your costs are going up, there needs to be transparency. And I think that we should all be hoping that our elected officials are going to deliver on that, because it's ultimately being good stewards of taxpayer money.
Well, thank you very much, Antonio. We hope we can have you back soon, and we hope this process moves along quicker than normal in the government. Okay.
Good luck.
Okay. So, listeners, thank you to our guest, Antonio Ciaccia, Director of Government and Public Affairs for the Ohio Pharmacists Association. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kiko Auctioneers and Realtors, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you back here next Friday, right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. The preceding program was sponsored by the Medicine Center Pharmacies.